Good morning, everybody. Good morning. We, the women of the Senate, are here today to speak for the 42 million Americans who right this minute have no health care, but they have hope because of the full implementation of Obamacare. And yes, it is Obamacare because Obama does care. And all of the people who got elected alongside of him do care. 42 million people in the United States of America don't have a doctor, don't have access to a doctor, but they have hope because the health care is being implemented. We speak for the 150 million women in the United States of America who now have health care because Obamacare has been implemented. Being a woman in the United States of America is no longer considered a pre-existing condition by the insurance companies. We have been denied health care because of pregnancy, because of domestic violence, and because of other things natural to us. We're here to speak for that. And I'm also here to speak for the mother of DeMonte Driver, a little boy in Prince George's County who died because of an infection an oral infection he had, because the family did not have access to dental care. They waited too long, had too little opportunities, and far too little money. Within the shadow of the Capitol of the United States, DeMonte Driver died. We wanted to say that was unacceptable. So working with our president, we passed the Affordable Care Act. And we're going to make sure the Affordable Care Act, which is the law of the land today, stays the law of the land tomorrow. We will not let Obamacare be defunded or repealed. We will not go back to the dark ages when being a woman was considered a pre-existing condition. When we women were often paid 2, 3, 4, 5 times more for the cost of insurance than men of comparable age and comparable health status. When an insurer could tell a woman in a letter who had had a premature birth, had had a cesarean, that in order to get health insurance from them ever again, she had to be sterilized. A letter at a congressional hearing. We couldn't believe it. It was bone-chilling. But what is even bone-chilling is the mockery that's going on the Senate floor. This country faces serious crises. We face crises because of threats across the seas. We feel the crisis of unemployment. We feel the crisis of educational achievement. But my God, we thought we had solved the crisis of access to health care. And we're going to fight to do it. There are those who are standing on the Senate floor who will say they will talk, and they will talk, and they will talk so that we defund Obamacare. He could talk for the rest of his term. He can stay there day and night. He can force the shutdown. He can play slam-down politics, and those who are colluders, collaborators, and enablers can stand with him. But we're going to stand with the American people. We're going to stand for those 42 million that are just waiting with hope in their heart. We are going to stand with the 150 million women who want to be treated as American citizens, because we believe in the United States of America, you should have a doctor when you need it, that you should have the medicines that you need it, and that you need to have a government that you could count on. When it passes the law, when it passes, then it stays the law of the land. We're going to work together. You hear the compelling stories. You're going to hear my colleagues where we all work together on a variety of benefits. But remember who we're fighting for. Right this minute, in the United States of America, one of the richest countries in the world, 42 million people don't have health care right this minute. Are we going to say no to them and yes to what's going on the Senate floor? Are we going to say to the 150 million women, well, you can pay more. You know, you need a doctor more. Well, we need a doctor maybe more because we have children. You've heard them speak today. And we're going to say to the mothers that if your little boy or girl has a toothache, you're going to be able to make sure you don't end up with an ache in your heart because he did not have access to health care. We're going to fight, and while they try to say no, we're saying yes to the American people. Thank you.